Hello, everyone. My name is Camille Benitez, and I'm the Senior Director of Provider Partnerships at Equip. And on behalf of Equip, I'd like to thank you for taking the time to learn about eating disorders during Eating Disorder Awareness Week. And it's my pleasure to introduce you to your presenters today, Dr. Catherine Hill and JD Oled. Dr. Catherine Hill is Equip's VP of Medical Affairs and head pediatrician. Prior to Equip, she was a clinical assistant professor in the Division of Adolescent Medicine at Stanford University. And JD Oled is Equip's Director of Mentorship, and she has been a fierce eating disorder advocate and coach for a decade after she helped her youngest child through her own recovery. And you'll hear more about that story in this presentation. Dr. Hill, take it away.
Thank you, Camille, for the introduction, and thank you all for joining us today. So by the end of this talk, I'm hoping that you'll be able to describe some common myths, risk factors, and dangers of eating disorders, to identify some common signs of eating disorders in children and adolescents, to discuss strategies for starting a conversation with a loved one about eating disorders, and we'll also talk a little bit about the basics of family-based treatment, also known as FBT, which is the gold standard treatment for eating disorders. So let's start with some stats on eating disorders. Unfortunately, during the COVID-19 pandemic, we have seen rates of eating disorders skyrocket. And we've seen roughly a 50% increase in hospital admissions for eating disorders specifically. And we know eating disorders are very deadly. They are the second deadliest mental illness, second only to opioid addiction, and they have a 4 to 5% mortality rate. And unfortunately, about 5 million Americans will develop an eating disorder this year. And so you can see how common that they are. So who develops eating disorders? Now, there are a lot of stereotypes in society about the types of people who develop eating disorders and also who receives proper treatment and support. So I think a lot of people, when asked, who develops an eating disorder, think about thin, white, upper middle class teenage girls and young adult women. And these women do get eating disorders, yes, and they're most likely to have their eating disorder identified and treated. But I think it's a really important point that eating disorders affect patients of all ages, all genders, all ethnicities and socioeconomic statuses, and also all body sizes and BMIs. And so these populations that don't fit neatly within this stereotype are often getting diagnosed late or sometimes never even getting diagnosed and referred to treatment. So while eating disorders are thought of as psychological disorder, they really can affect every organ in the body as well. And so they're also a medical disorder. So they can affect your heart in terms of lowering your heart rate, lowering your blood pressure, and even causing irregular heartbeats. They can affect your brain. So eating disorders by themselves can lead to depression or anxious mood. And lots of times you get obsessive thoughts about food or exercise. It can affect skin in the form of dry skin or hair loss. It can lead to changes with your gut. A lot of people have lots of abdominal pain and constipation and bloating after meals, and sometimes go to see a GI doctor or a gastroenterologist before they get identified as having an eating disorder. Hormones get affected in the form of irregular periods in those who can have periods, and that can lead to decreased bone mass later in life, both for males, females, or really anybody. And it can affect your blood. So you can have abnormal lab tests with low white blood cells, low red blood cells, or low platelets, and lead to things like fatigue, electrolyte abnormalities in your blood, and vitamin deficiencies. So really, every organ in the body can be affected. Now, there's a lot of myths out there about eating disorders, and I think it's really important to hammer home the truths. So eating disorders are not a choice. Nobody chooses to have an eating disorder. Another misconception is that you can look at somebody and say, oh yeah, that person over there has an eating disorder, but that's just not true. And we know that most people that have eating disorders, you'd never be able to pick out in a crowd. Eating disorders are not anyone's fault. So you cannot blame a parent for having an eating disorder. You cannot blame a doctor or a teacher or a coach or the patient themselves or any social media. Eating disorders are extremely complex, and they are brain disorders and largely genetic, and nobody gets to pick their DNA. And in a genetically predisposed individual that has the right environmental influences and psychosocial factors, as well as somebody who's restricting their intake, that creates the complexity of an eating disorder. Another misconception is that eating disorders are not treatable, that once you have an eating disorder, you're always going to have an eating disorder. That's also not true. In fact, with proper treatment, eating disorders are extremely treatable, and we believe for every patient, full recovery is possible. With that, I'd like to pass it over to JD.
Hi, thanks, Dr. Hill. I think our story contains a lot of things that really touch on this presentation, and want to acknowledge that my daughter actually and our family did fit the stereotype, and those are factors that led to a really rapid diagnosis. And also, I think it's a diagnosis that could have been missed because in a lot of ways we didn't fit anywhere near some of the stereotypes related to old beliefs about parenting and things like this. And I'm really always grateful that we had a pediatrician who was so very knowledgeable. So our story in 2011, at the end, near the end of 2011, my daughter, who was a great academic kid, athlete, all of that sort of stuff, she and her friends were done with their high school sport. There's all the buzz about putting on the freshman 15 next year. So they decided to undertake a healthy eating makeover, and it was all extremely reasonable. And she also went into this without having any body image or self-esteem issues. Certainly, sort of nothing that would stand out among her peers, and honestly was a lot better situated in some ways than they were. And it all began very sensibly. And we did not understand, we didn't realize that she was genetically vulnerable to anorexia because my mother-in-law, who we were unaware of, had had a critical period of anorexia as a teen, and then had been living with this for a very long time, and in fact does still today at the age of 81. But luckily, she had anosognosia, or lack of insight, very strongly. So she really had no idea what was going on, other than that she knew she suddenly couldn't eat whole categories of food like carbs, things like that. So she was accurately reporting her medical symptoms. And we were at the pediatrician and, seeing a gastroenterologist and trying to rule out all the physical things that could be wrong and causing all of this, given that she did not understand what was happening. We had a very scary emergency room visit where she was extremely dehydrated, had orthostasis. She'd fainted a couple times. So we were lucky that we fit the stereotype, and it's also made me very passionate about making sure that all those who don't fit the stereotype get the same quick access and diagnosis we have. Next slide, Catherine. So it's what to look for. I wish I had known what to look for. I really had no idea. So some of the warning signs for eating disorders occur over a whole bunch of areas, and a lot of them really appear innocuous or sort of very socially normed. So we talked about food and eating, that my daughter and her friends had gone on this healthy eating makeover. One thing that I wish I had known about was that as people go into this malnourished state, they often became very focused on food and interacting with food in ways that don't include eating food. And so she became really obsessed with the food channel, with Pinterest, with penning recipes, with making beautiful, gorgeous food that she shared with other people but didn't eat herself. So if your child has a newfound interest in that kind of thing, or they're cooking and baking for others and not eating it, that's a huge flag. Activity and exercise. So if, we were an active family, a bit of a gym family, all the kids were athletes, but the exercise sort of took a different turn. So really be alert for all of that. In the social realm for her, she really pulled back on all of her friendships, which was very unusual and confusing. And the reason that's often an issue is if you're a teenager and you're spending time with friends, teenagers eat. They're going to want you to eat. They're going to ask questions about why you're not eating, that sort of thing. All of that really was impacting her mood as well. My previously never depressed kid was very, very depressed. She'd had maybe some low-level anxiety, which is really common, but now it was a whole different stage of things. Her thinking was absolutely convoluted, and we weren't really able to engage in any logical conversation about this because she was super confused why food was suddenly terrifying to her. And then all of those medical aspects that Dr. Hill touched on, and the very first things we saw, I think, were related to that, just sort of like doesn't look, her hair didn't look vibrant anymore, her skin, all of that sort of thing. And then the stomach issues for us were very, very prominent in this, and they were the first place that we were looking. So lots and lots of stuff to look for. The biggest thing in there is if your spidey sense tells you something's wrong, keep investigating. And so if you are worried about what your child might have an eating disorder, I'm an expert in what not to say, because I think I said all of the things that you shouldn't say, and it's really, really common. Some things that people will say are, because we look at eating disorders across a spectrum of eating disorders, not just sort of fully restrictive like anorexia, but sometimes people who are restricting will also then end up binging, and parents might realize that their kid, they don't know their child isn't eating all day long. What they do know is after everyone else goes to bed, that the fridge and the cupboards are being raided. So you're eating us out of house and home, we're going to lock the refrigerator. Or children sometimes will keep their uneaten lunches in their backpack as sort of a bit of a silent cry for help. And parents could interpret that in another way. And, like, what are all these lunches doing? I don't put all this work in to pack your lunch to have you waste it. Are you looking for attention with this eating nonsense? It's very confusing to parents, and sometimes that's how parents react. And then I don't know a single eating disorder parent, even the ones who maybe had a higher level of knowledge going in, who at some point didn't just say, just eat. And that is pretty much wholly ineffective and will frustrate you and your child. So some things to say instead. Want to preface this by saying it's really important to check yourself before you have these conversations and get into a place of non-judgment, non-shame, and just say something like, hey, I noticed that your lunch hasn't been eaten this week. What's going on? And in my daughter's case, she would answer that very honestly. That, yeah, I didn't eat it and I just can't eat and I don't really know why. You're starting needing to use the bathroom right after every meal. What's going on with that? And if you've got non-judgment and non-shame in your voice, your child is a lot more likely to acknowledge that they've been purging or engaged in one of those behaviors. So being calm in the middle of your fear is really important. So what do we want to do if you're worried about your child? Make an appointment with your pediatrician. Your pediatrician is going to check height, weight, vitals, get lab work or an EKG. Really important. And if you don't have a pediatrician, your community health center, that sort of thing. And then understanding that eating disorders do require a multidisciplinary team. So you're going to want to get your child the treatment with the most evidence behind it. We'll talk a little bit more about that in this presentation. And just recognize, Dr. Hill said this earlier in a slide, don't treat this as a phase. Early intervention is one of the best predictors of good outcome, and in fact was a huge factor in our situation, why we're doing so well.
All right, I'll take it from there. So the gold standard for children and adolescents living at home with family with eating disorders is something called family-based treatment, or FBT. And I'll talk a little bit about what that means. So first, before we get into the logistics of FBT, I wanted to share that the difference between treatment that feels good versus treatment that works. And as parents, I think we're often looking for something that's going to comfort our children and make them feel good. And part of treating an eating disorder, the first priority is actually getting their brain nourished again and getting their body nourished again. And so that's really the gist of family-based treatment is the first process before we do any sort of individual therapy, individual work with teens and young adults and children with eating disorders, is to do this family-based treatment where you empower families to go in and help their children eat and re-nourish them. So that's why at Equip, we do this family-based treatment rather than individual therapy, even despite that thought I think a lot of families have that, oh, well, I'm just going to send my child to a therapist and they can chat one-on-one for a little while and then they're going to feel really good. But we know that for people who are in the midst of an eating disorder, their brain is really malnourished and they're not able to process individual therapy in a helpful way. And so some other benefits of FBT are that it allows the family to continue to live at home, to go to school, to be social with their friends, and to participate in a lot of their activities that they love to do as long as they're medically cleared to do so. So this is a bit about Equip. We we provide patients with a dedicated virtual 5-person care team. And our care is a little bit unique in that we add some members to the team that I think has been a wonderful addition to our treatment program. So all patients get a medical provider who's a pediatrician or pediatric NP. They get a registered dietitian. They get a therapist who's trained in FBT or family-based treatment methods. And my favorite part is actually the addition of the family and peer mentors. And so a peer mentor is typically a young adult who's recovered from an eating disorder themselves, who helps support the patient and really helps work with them to see that there is a life worth living without an eating disorder, and that recovery is not only possible, but it's really the desired outcome. And a family mentor is somebody who's had a child like JD, who's recovered from an eating disorder, who can help support our families, our caregivers in this difficult time. And Equip was actually started to be virtual, and we adapted the in-person treatment to be fully virtual. And this has lots of benefits, including increased accessibility. So families are able to access us from work. They don't have to leave work to attend sessions. Our patients don't have to leave school to attend sessions. And the amount of school missed is very minimal compared to some other programs. So families can also schedule at their convenience, and based on the provider availability, they can schedule their own appointments online. They can message providers whenever they need to, and bring their village. So this is a great model, I think, for families who are divorced, or if they're grandparents that want to be involved in treatment, or sometimes for our young adults, significant others who might want to be involved in treatment. Your support system is there with you and can come in from anywhere, versus the old way of doing it, where you had to get off work, go pick up your kid from school, drive across town, find parking, go into the office, and repeat that process multiple times a week for many months. So I think that the virtual model really lends itself well to eating disorder care. And we also, I think some people think, oh, well, virtual, that's not going to be as good as in-person care, but there's actually data now that shows that it is as good. And especially for the therapy piece, you can still build rapport and have a really solid outcome, even with virtual care. So we're really excited about our outcomes so far at Equip, and we are helping setting families up for lasting recovery. And what that means is that 97% of parents are reporting feeling more confident in caring for their child with an eating disorder. 74% of patients have reported a reduction in their eating disorder symptoms, which is on a validated questionnaire. And 2/3 are reporting improvements in mood. So like I was talking about how malnutrition can affect the brain and lead to just by itself lead to depressive symptoms or anxiety symptoms. A lot of 2/3 are reporting improvements in mood, which is largely due to the renourishment process. All right, I'm going to pass it back to JD, who has a happy ending for this story.
Yeah, so excited to do this, especially given that we are at the milestone of a decade out from the beginning of this whole experience, and cannot say enough about the fact that it is aggressive evidence-based intervention that made all of the difference for us. And one of the reasons I'm here to Equip, hoping to bring this to other families. And so we did not have access to virtual care in the same way. So we were in a partial hospitalization program. So she actually did end up missing a fair amount of school. And even with that, within a year, she was able to move on to living her best life because of the parent empowerment component, because of the psychoeducation for her, because of our understanding of the neurobiology. We were all able to do the work we needed to do and move her into a self-management space with this. So I'm so happy to report at 27, she's traveled extensively all over the world, has undergrad degrees in psychology and criminal justice. She's currently a law enforcement officer. She's working on her master's degree in counseling. She's engaged to be married, and in fact is going to be married on March 3rd, just about 10 years from the day she entered her treatment program. And she's planning to move to Okinawa with her Marine captain husband after the wedding, and we are not worried at all. And that really speaks to full recovery. Is it possible? She is in full recovery, and that means that our entire family can feel safe and comfortable with this. And so her gratitude, and she writes and speaks on this on her own sometimes, for all of our entire family's tenacious fight for her to get well is boundless. And one of the things that does come up sometimes for people with FBT is it doesn't work for older kids, or it's hard on family relationships and that sort of thing. And I just want to really acknowledge that all sorts of medical crises are very, very hard on families. That's a very true thing. And when you have the proper support, the wraparound support of a program like EQUIP, you can not only move through this, your family will become even more, will become closer, more empowered, all of that sort of stuff. And I'm often will tell other parents, all parents say they do anything that they could to save their child's life. And eating disorder parents who have done FBT are doing that thing. And the rewards of it are absolutely immense. So love sharing that always. So really want to wrap up with saying, for all parents, an understanding of eating disorders and treatment is what enables you to get treatment for your child. We hope that you'll never need this information, and you may need it personally, you may need it for other people. Now that you've learned this, you're really going to have a really good basic understanding of the landscape of all of this and be able to help maybe other folks as well. And that it is so tempting to sort of wait and see. And I think part of the temptation to wait and see is actually sometimes an intersection with sort of diet culture, where maybe we went on a diet and maybe we took it a little too far, but then it was okay. And it's really important to know that this is a very different thing. So we don't want to wait and see. We want to intervene very early because we can go through this a lot faster. And if we delay treatment, we actually end up costing people a lot of their health and independence. So we're going to send you some additional resources via email that we're very excited about, and really appreciate you being here, listening and learning today with us. So for a free consultation, we'd be happy to put an expert input into some of the concerns you might be happening. So you've got our website here, our email address, and our phone number. So we're available all of those ways, and would love to help you and steer you in the right direction. So we'd like to dive into a few questions that we've gotten, and I'm going to ask you, Dr. Hill, one of the questions that we got, and I think it's such a great one, it's something I talk to people about. My son is an athlete and really concerned about healthy eating and exercise. Can boys even get eating disorders? How would I know if it's a problem?
Yeah, no, I love that question, because I think males are a very under-recognized population and often go many, many years or sometimes never get picked up as having an eating disorder because, again, society just doesn't tell us to think about males. But we certainly treat a lot of male patients at EQUIP, and they make up about a third of eating disorder patients, we think now, and maybe even more. Maybe we just haven't in the studies been able to see as many as there actually are. So in some ways, I think males sometimes present a little differently, not always, but sometimes they present a little differently. So instead of, females often strive for thinness, and that's part of the eating disorder, but sometimes males are striving for altering their body to be more muscular or more fit or toned or cut, and they might be taking lots of supplements and trying to bulk up and have lots of muscle, and so it can look a little different than somebody else with an eating disorder. So I think it's a really important point, because oftentimes when we do see our male patients presenting, they are sicker than other patients as well. And I've had male patients presenting with heart rates, in the high 20s or low 30s, and normal is about a heart rate of 60. So it's really important, I think, for everybody to know and recognize that boys and males do get eating disorders, and they get them quite frequently.
And I want to circle back to, with all of this, if you're asking the question, that's a little bit of your gut, what I call your spidey sense coming in there. And I really encourage parents, don't gloss past it. If you're thinking it's something to look into. We got another question about, I'm a single mom, divorced. How does FBT work with two households? Can it work?
Ooh, also a great question. So Yes, absolutely. FBT can work with a divorced household. And I think the Equip virtual model really lends itself well to that as well. So you can have all family members joining in. And I think it's sometimes a little more challenging to get everybody on the same page, but it absolutely can be done and can have excellent outcomes, as we would expect and hope. So I think, again, the Equip virtual model is really helpful in terms of getting families to treatment that otherwise maybe wouldn't have been able to have all of their caregivers present.
Yeah, and I want to put in a plug for one of the pieces of feedback we get from our families is the alignment. They're not hearing mixed messages from different care team members because we all work together. And so there's something to be said when everyone's showing up to the same sessions, hearing the same things. That really very often does enable families who might have a lot of conflict otherwise to sort of table the conflict, focus on what's at hand, and move forward with that common understanding because they are all coming to sessions and that kind of thing.
That's right. And we also have at Equip, we have some family mentors, for instance, who have had personal experience with this exact thing and can help work the family through, even if they're not all on the same page, help support the family so that we can get these kids to full recovery.
Mm-hmm. And we have, it's worth pointing out, I think, that we also have fathers as mentors as well. So it's not just moms, it's dads too.
Yeah.
Does FBT mean that my child would be missing school?
Yeah, so also a great question. So I think one of the benefits of FBT is it probably, out of all the treatment options, not only is it the gold standard and has the most evidence-based in terms of getting patients to full recovery with eating disorders, but it also is the option that leads to the least amount of school missed. So that's something that I love about it, and it really helps keep the child in their usual environment and build skills in their usual environment. If a child goes away and is in a residential program or is in a day program, which are very common, oftentimes they are not able to develop the skills they need to be in their usual life. And at the end of the day, the goal here is to get patients back to their regular, amazing life and not have to worry about an eating disorder. So they will have to miss some school. There are going to be times that maybe they have to get pulled out of class to go do a session with their therapist. But the amount of school missed is significantly less than with the other options available.
Yeah, and I want to address that sort of from a personal note as well. Before I switched occupations, I was an educator, so I was a middle and high school teacher. And had a very academically oriented child, as a lot of these kiddos, are. And I think it's important to look at this sort of big picture in terms of what does missing school mean. I don't regret the time we had off of school because it got my daughter to full wellness. And I do think that with what we have at Equip now, there would have been less school loss. And really, everyone at Equip understands how important this is. And I really love that we have, in addition to that robust team, we have family navigators who will help you with all the paperwork related to the school and how you're going to get meal support and when they do need to have a private space to have a session. So we recognize that we really want to have them be in school, and we really support them with sort of robust ways to interact with the school so we can get the school understanding what's happening and have this really supportive wraparound environment for your kiddo.
Yeah, and I also want to point out, I'm a working parent myself, but the amount of work that parents have to miss going to more traditional treatment is really significant. And so I think with this model, families should be able to continue to go to work and stay in their jobs while they're helping their child recover from an eating disorder, and that's huge.
It is huge. And I would say, because we're doing this, right, who knows where we will eventually go with the pandemic, but I would see a real rise in the desire for parents to make sure that their kids are fully engaged academically, socially. We really understand all that we've missed. And while Equip, we built it to be virtual before the pandemic, I would say that the pandemic really taught us a lot and got the whole world sort of studying what does this look like to have all of this virtual care. And it really is the thing that really supports, again, engagement in life, building that piece of it, and keeping kids moving forward within their lives, which is just awesome for families.
Absolutely. I wish we could answer everyone's questions today, but I think we're running out of time. But we really appreciate you taking the time to listen to this. And again, you have our email, so feel free to reach out with any questions. Thank you so much for your time.
Thanks so much for having us.